Hi, my name is Lori Walker-Krause and I am a registered physiotherapist here in Calgary, Alberta. I have over 17 years of clinical experience treating infants with torticollis, plagiocephaly, and a wide variety of developmental delays. As a result, these babies hold a very special place both in my heart and in my clinical practice. Today, I want to provide you with some tips and tricks to help correct a flat area on your baby's head shape, also known as plagiocephaly or baby flathead syndrome. If you are watching today, you have likely already noticed a flat area developing on your baby's head, or your family doctor or public health nurse may have pointed one out to you. You may also be watching if you have not yet noticed a flat area, but you have noticed a tendency for your baby to always want to look primarily in one direction, and you are trying to stay one step ahead of the game. Regardless of what has brought you to this video, I hope that the tips and tricks that I will discuss will prove useful to you. However, I do want to stress that these are general suggestions only, and they are not meant to take the place of medical advice. If you have specific concerns regarding your baby's head shape or their neck and their tendency to want to tilt or turn in one direction, please address these concerns directly with your primary care provider. Now, to get us started, I want to give a basic overview of two medical terms that you might hear: plagiocephaly and brachycephaly. They are big words, but I want to make sure that we are all speaking the same language as we move forward. Plagiocephaly is just the medical term for an asymmetrical head shape. Basically, when we think of your baby's head being a typical shape, what happens with plagiocephaly or brachycephaly is over time, when consistent pressure is applied to the skull, the bones start to deform because they are so soft in those first 6 to 8 weeks of age. With plagiocephaly, we tend to get flatness on one side of the head. As that flatness develops, everything on that side tends to shift forward. So if we have a flat area on the back right side of the head, we're going to see a forward shift on that whole right side, where we'll see the right ear sitting slightly further forward than the left. And at the front of the head, on the forehead, we'll see what we call bossing, or some movement forward of the forehead. In these pictures, you can clearly see the flat area on the back of the head, the ear shift forward on the same side as the flat area, and the frontal bossing, or that movement forward of the forehead on the same side as the flat area. In this last graphic, we see a picture of brachycephaly on the left and plagiocephaly on the right. For brachycephaly, that refers to flatness in the center of the back of the head, and we see more of a flatness right across the back of the head, often accompanied by a slope to the forehead or some increased height at the back of the head. In this image of brachycephaly, we see that central flatness at the back with an increased width of the head at the level of the ears. In this image, we again see that central flatness at the back with a reverse inclination to the head and increased height of the head at the back. This image also shows that central flatness at the back and that increased head height. Very commonly, we will see a combination head shape where we get flatness in that central back region and then flatness a little bit more on one side or the other. We call this a combined brachycephalic plagiocephalic head shape. This image shows that combination head shape very well, and this second one shows it also with that central flatness and increased flatness on the back left. There is a condition that you should be aware of called craniosynostosis that you may come across as you are doing your Google searches on plagiocephaly and brachycephaly. Craniosynostosis refers to the premature closure or fusion of the spaces in between the cranial bones in the skull. This is a medical condition which requires surgery. This is again a reason why, if you have concerns with your baby's head shape, with the flat area that they are developing, please ensure to have it assessed by your primary care provider. Although it's important to be aware of craniosynostosis, please know that it is very rare, affecting an estimated 1 in 2,500 live births. The vast majority of flat areas on a baby's head shape are due to deformational plagiocephaly. Now, if you are wondering how to look at your own baby's head shape to determine if they have plagiocephaly or brachycephaly, the best way to do this is with a bird's eye view. So looking down on your baby's head shape will allow you to see their forehead, their ears, and the back of the head. You can even stick your fingers right in front of their ears, just so when you look down, you can see if they are starting to get a little bit of a shift there. In these images, we see how useful a bird's eye view can be in determining severity of plagiocephaly. For brachycephaly, a side profile view is also very useful so that we can see the amount of flatness at the back centrally, but also the reverse inclination of the forehead and the resultant increase in height at the back of the head. In this bird's eye view, we see a moderate case of plagiocephaly with flatness on that back left side. And in this more severe case, we see flatness on the back right, and we also see a significant shift in the right ear and right side of the forehead. The bird's eye view is also very useful for brachycephaly to see the flatness in the back centrally, but also that increase in width of the head. Aside from just looking for a flat area at the back of the head, you also want to look for asymmetry in your baby's facial features. Typically, what we will see with plagiocephaly is that the eye on the same side as the flat area will appear wider or slightly bigger or more open as that orbital bone is pushed slightly forward. We will also often see the cheek on that same side as the flat area looking bigger or more full, with the cheek on the non-flat side looking smaller and flatter, especially with an accompanying tightness of the neck muscles, as those neck muscles will pull the cheek down and back. With this little one, we can see how that right eye and cheek appear larger and more full, that left cheek looking flatter and more pulled down. This little one, we see that left eye and cheek appearing larger and more full, and that right cheek appearing smaller and pulled down. This shows us another good view for evaluating facial asymmetry in your baby, as when we are looking upwards, we can clearly see that forward shift of the right side of the forehead and right cheek and orbital bone. If you are in the Calgary area and would like assistance determining the severity of the flat area on your baby's head, infant physiotherapists are available at Milestones Physical Therapy Services, Lakeview Physiotherapy and Acupuncture, Calgary Youth Physiotherapy, and at Vita Health and Wellness. Due to COVID-19, all of these providers are currently offering virtual therapy assessment and treatment via telehealth. Thank you for watching today, and stay tuned for Chapter 2 on torticollis to learn how tight neck muscles affect your baby's head shape.